Hi, I'm Greg Fell, Director of Public Health at Sheffield. This is a situation report and epidemiology of the 10th of January 2022, first of this year. What a difference a few weeks makes is the first comment. So for most of the late summer into autumn and early winter, case rates trundled along at about 250 to 300 per 100,000. Currently, they are well over 2,000 per 100,000, so many orders of magnitude higher. That is on account of the Omicron wave, which started in London and the southeast, but has spread definitively across the whole country now. Brought a whole new meaning to the term exponential. The rates have gone up really quick. Probably has peaked in London, beginning to come down. We're at least 2 weeks behind London, and then of course the pressure in terms of people being poorly will lag even further. So case rates are really high, and that in itself is causing problems on a number of counts, both in terms of the business continuity, running services, running businesses. People are off, and if they're off, they'll be poorly, or even if they're not poorly, they'll be required to isolate still. So running businesses is really important, but also people are poorly. So milder doesn't necessarily mean mild, and I shall come back onto that at the end. Case rates going up in all age groups. First off was going up in the sort of early working age adults, but now going up really quite quickly and to a very high, so high I'd say very worrying rate in the over 65 population that is beginning to be seen in hospital. Well, no, it's well beyond beginning. It is being seen very definitively in hospitalisation rates at the moment. Milder, so what we're seeing is that people in hospital have milder illness and probably less use of intensive care. It's still not a mild illness. It is hospitalising hundreds of people a week, and that narrative is really important to get right. It is milder, no two ways about it, than the Delta wave that was before it, but many more people are getting it. Many of those are becoming seriously poorly enough to be in hospital, but even poorly enough to be pretty sick for a few days. So and that will continue for some time to come yet. Vaccine coverage. Vaccines are protecting us. There's no qualms about me saying that. One of my worries early on in Omicron was the propensity for immune escape. Would the vaccines work as well as they have done against Delta and earlier variants? I was worried about that. Yes, appears to be the answer. The vaccine protection against severe disease has held up pretty well. All up, we've got in the order of 75, just short of 80% of the population fully vaccinated, including boosters. There was a huge push on getting booster jabs in the weeks running up to Christmas and then between Christmas and New Year. A massive increase, nearly 100,000 boosters given in that period, and credit to all those who made it happen, because it didn't happen by magic. That in itself will have saved lives. There's absolutely no uncertainty in my voice there. That has had a massive impact and probably has spared us from what may have been a much worse situation had we not done that. There's more to do with regard to vaccination. Still 20-something% of the population haven't had any vaccine yet. It is never too late, and having some vaccine is certainly better than having no vaccine. So there's more to do on that, and there are many walk-in clinics operating across the city on a day-in, day-out basis. Look on our website or the hospital website, and they're fairly easy to find where you can be vaccinated. So 10 issues at the moment. Testing, it has been a problem. It's beginning to ease. Access to PCR tests and lateral flow device tests was certainly a problem over Christmas and New Year period. It's beginning to ease now. Business continuity, running services, running businesses with so many people who have COVID is a problem, and you will see disruption to many things that you just take for granted, and that will be a feature of the next couple of months, I would suspect. There is huge, possibly unsustainable pressure on the NHS and social care system. All of the media narrative is on the hospital. I shall remind you that the hospital is as good as the services around it, and hospital is good, but there's also pressure in primary care, there's also pressure on social care. That's unprecedented, exceptional and unsustained. And that will have consequences in the coming weeks and months. There's no two ways about that. I worry a lot about the steepening rise of Omicron case rate in the over 65 population. I worry an awful lot about the 100,000 people or so who have not yet been vaccinated, 22% of people aged over 12, many of whom have made an informed decision not to be vaccinated. I would encourage you to check the basis of the informed nature of that decision. I only ever encourage people to look on gov.uk or nhs.uk websites for credible information. There's an awful lot of misinformation on social media and elsewhere. That is costing lives. So I'd encourage you, if you haven't yet been vaccinated, please look at the gov.uk or nhs.uk websites for that. We're beginning to see cases again in care homes. Not as much harm as we've seen in previous waves, but we're beginning to see cases. And last point from me, London is beginning to top the peak of the curve and go back down. Sheffield will follow, but Sheffield isn't London. The shape, the timing and the nature of the curve is different in Sheffield, and thus the impact will be different in Sheffield. So we can't make assumptions based on what happens in London. We will have to ride this one out and see. Lastly, why should I bother? It's mild. It's milder than Delta, but it's still hospitalising hundreds a week. Long COVID is still a problem, and it might be mild for you, but chains of transmission and protecting the vulnerable remains really, really important. So sadly, it's not over by a long stretch, and we've still got a way to go yet. So our changes to testing will be implemented from tomorrow, the 11th of January. From the 11th, people without symptoms who have a positive lateral flow device test will no longer have to take a confirmatory PCR to confirm the result. Instead, they must report the result online or call 119 and self-isolate. They'll be contacted by a contact tracing service, so their contacts can be notified, as happens now with people who have a positive PCR test. People will be able to leave self-isolation 7 days after the result of the initial positive test, providing they receive 2 negative LFD results 24 hours apart on day 6 and day 7. That new testing guidance will remain in place whilst COVID case levels remain high, because the vast majority of people who have positive LFD results are now extremely likely to have COVID. However, anyone with COVID symptoms, most obviously cough, fever or loss of taste and smell, must also take a PCR as soon as possible and self-isolate whilst they wait for the result. So on vaccination, firstly, thank you to all those who went to get their booster over the Christmas period. Much higher rates of booster vaccination, and we're still the leading of the core cities. So great, well done to Sheffield on that count. It is never too late. So if you've not managed to get around to it yet, it's never too late, and there are lots of walk-in clinics available all over Sheffield for first, second, or booster doses. Vaccination teams will be returning to schools this term to provide second doses and first doses for those that haven't already had a first dose. Importantly, Sheffield Medical Centre on Spittal Street in Burngreave will also be vaccinating 12 to 15-year-olds next Monday, the 17th, from 9 till 4:30, and you don't need to make an appointment to go there.